TLDR, the bottom line is that we will get a 2% pay cut in the conversion factor. Sequestration is staying, and pay-go is being delayed by a couple of years. So if you want to hear the details a little bit more, continue to watch. My name is John Lin. I'm a urologist in Gilbert, Arizona, also your humble host of the Thriving Urology Practice Facebook group, where we crowdsource practice management solutions for everyone's benefit. Thank you so much for joining me on this live stream. As you all probably heard, going into the end of 2022, there is going to be a significant decrease in the physician payment by Medicare. As usual, just like the unsustainable growth rate, also known as the SGR in the past, Congress decided to kick the can a little bit further until maybe 2024, maybe after the 24 elections. I know healthcare should not be political, but it is. All right, so Congress passed H.R. 2617. It's a 4,155-page resolution. For those of you who are interested or have insomnia, feel free to read it on congress.gov. It was passed and signed by President Biden at the end of 2022, December 29th of 2022. Originally, the final rule from CMS came out, and physicians were going to take about a 4.5% decrease on the conversion factor, plus a 4% decrease due to pay-go. And as you already know, we already started taking a pay cut from sequestration, 2% pay cut, starting July 1st of 2022. So the effect was going to be devastating. A lot of lobbyists, a lot of people working behind the scenes allowed the passage of H.R. 2617. It's the omnibus bill or the consolidated appropriations bill. So a lot of changes. The bill is not just for Medicare changes and physician payment changes. It's got a lot of other pork and everything else built into it, just like any other bill. It's a $1.7 trillion bill that was passed and signed by President Biden. So in essence, in 2023, instead of taking a 4.5% cut on the conversion factor, the sting has been lessened, and Congress decided to give us a 2.5% bump. In essence, a 2% decrease on the conversion factor. 2% decrease overall. So don't let the politicians and the fake news tell you that you are getting a 2.5% increase. No. We took a 4.5% cut first, and then they raised it 2.5% for a net decrease of 2%. So don't let the false advertising fool you. You're all getting a 2% decrease on the conversion factor for Medicare. Now, so what, right? Who cares? Well, you gotta look at how much impact that is to your bottom line. How much Medicare business do you have? How much decrease in payment are you going to suffer because of this 2% decrease in 2023? Are you going to continue to take new Medicare patients? As you all know, having insurance does not mean that you are going to receive care. Nothing is more clearly illustrated in this situation. A lot of you may decide not to take any more new Medicare patients. Heck, when I started practice here in Gilbert, Arizona back in 2006, a lot of primary care offices were not taking any new Medicare patients. That's correct. Yeah, you're thinking, what the heck, right? Unless you age into Medicare with this practice, primary care practice back in 2006, they're not going to see you. They would rather see better paying private payers, those patients, than to see Medicare patients. Just fact of life. A lot of primary care doctors are looking into direct primary care, which gets rid of Medicare. So they're dealing directly with the patient for payment. No more third party, no insurance, direct primary care. Or some of them are just going to cash only, the way it should be, right? Instead of having a third party dictating how you take care of patients. So having insurance does not mean that the patients are going to get care. And this is going to be more and more evident as Medicare continues to play this game. So we are getting a 2% decrease on the conversion factor. So that is the bottom line. Paygo, pay as you go. We were going to take a 4% cut starting January 1st this year. It is now January the 3rd, 2023. Well, Congress in HR 2617 decided that we are going to postpone the decrease, the 4% decrease, until December 31st, 2024. So we get a couple of years of reprieve. Doesn't this remind you, for those of you who are old enough to remember, doesn't this remind you of SGR, sustainable growth rate, or I call it unsustainable growth rate? When SGR was being passed, everyone's cheering, yay, this is great. Yeah, it was great for a couple of years. It was good for a couple of years, but look at where we are now. I knew this was going to happen. Wrote all about it on my Facebook timeline. SGR, bad idea, but everyone's all cheering. Well, this is nothing new. Those of you, all you need to do is look at history and how things happened in the past. So pay-as-you-go is being delayed. That 4% cut is being delayed until December 31st, 2024. Unfortunately, the 2% decrease starting July 1st of 2022, middle of last year, that stays. So that stays. We're still going to continue to take that 2% hit. Now, one thing good that may be happening, that is happening because of HR 2617, again, 4,155 pages of stimulating reading. One thing good that is coming out of HR 2617 is that telehealth flexibilities and waivers are going to be extended until December 31st, 2024. Initially, it was going to be extended. Becerra, the CMS Secretary Becerra was going to give us 60 days to notify us of the end of the telemedicine waivers. And then Congress passed a bill that will extend it by 151 days at the end of the public health emergency. So 151 days after the PHE has been declared ended. Well, now, as of now, December 31st, 2024, that is going to be the end of the flexibilities and waivers, which means relaxation of the place of service for the patient. They don't necessarily have to be in a designated facility, originating site, for those of you who know about telemedicine. So that means they can still be at their homes and receive telemedicine services. There are new modifiers and place of services that you need to be aware of if you're going to be using synchronized audio and video, and also audio-only visits. So that is the good news. That is going to be extended. And for those of you who are not doing telemedicine, you should jump on board. There are free platforms for you to try and sign up if you want expanded capabilities. Every day that I'm in clinic, I'm seeing telemedicine patients. All of my telemedicine patients are follow-ups. And that is just the way that I like to see my telemedicine patients. I don't feel comfortable seeing a new patient via telemedicine. My telemedicine patients are follow-ups. You should definitely look into it. And if you're interested, hit me up and maybe I can do a discussion regarding how I set up my telemedicine visit. In summary, I want you to consider chunking the telemedicine visits, telehealth visits together instead of intermittently seeing these patients. That has been the most efficient way for me to see these telemedicine patients. You would also work up these patients before the patient is put on the schedule or in the queue. Basically, the medical assistants are going to update the medications, past history, etc. So all you, the physician, have to do is to take care of the patient, meaning assessment and plan, medical decision-making. That is what you need to concentrate on. Everything else, gathering past history, updating history, should be done by somebody else. And as usual, as if the patient is being seen in the office, any records that you may be reviewing with that patient during that telemedicine visit, that needs to be included in the chart already. So when the patient shows up on your virtual platform, you already have all that information and you can bring it up on your screen. You can share your screen. You can show it to the patient. And one really cool thing about telemedicine is that if you're taking care of an older patient who may have extended family throughout the entire United States or sometimes outside of this country, you can now include them in your telemedicine visit. So imagine if you're seeing a patient with prostate cancer or bladder cancer or a renal mass, not only can you show the pathology report, not only can you show the CT imaging, MRI imaging to everyone who is in that call, you can now include all these family members with one telemedicine visit, and everyone will be on the same page. Everyone can ask their questions. So talk about an improvement in the way you are going to be able to take care of these patients. Talk about expediency and efficiency in being able to care for these patients. So anyway, let me know what you think about the pay cuts. I would really be interested in knowing what you are doing, what your practice is doing in light of the 2% decrease. Now, for urologists in the last 20 years, we have been taking a net decrease when you take into account inflation. We have been getting a pay cut over the last 20 years. How long are you going to continue practicing this way? How long are you going to be happily practicing with these last minute, not going to be a 4.5% decrease, you're only going to have a 2% decrease at the end of the year, at the very, very last minute. Literally, Biden signed this into law, HR 2617, on December 29th of 2022. So 3 days before the turn of the new year. How many times do you want to go through this? How many times? So anyway, let me know what you're doing regarding your practice and how you plan to go ahead, and let me know if you are using telemedicine. I'll be really curious to see your responses. As always, take care of yourself, take care of each other, and thank you for the privilege of your time. Bye-bye.